Are you someone who feels like your chin is very weak and small and it is out of balance with the rest of your face? You're considering a chin implant surgery, but you're a little bit worried. Is it the right surgery? Is it a big surgery? What about other options, genioplasty? To discuss all this, I'm Dr. ANIKETH Venkataram, plastic surgeon at the Venkat Center for Aesthetic Health, Bangalore. Now, who do we consider a chin implant surgery? We look at basically two things. One is the horizontal projection of the chin. We look at a vertical line from the lower lip and see where the chin is in relation to that. In men, we want the chin to come at the level of the vertical line from the lower lip. In women, we want this to be 1 or 2 millimeters behind. So when the chin is very much behind the lower lip, we're talking about 10 millimeters, 12 millimeters, 15 millimeters. These patients are the best candidates for a chin implant. The second thing we look at is the vertical height. We see the upper third, middle third and lower third of the face and see if the lower third is lesser in height. Here, in general, chin implants aren't going to give much of a vertical lift. It will give you a horizontal lift. So those who need a vertical lift, other options such as a genioplasty might be better. So this is how we take a decision on who is a good candidate for a chin implant. Most people have good vertical height and they only need horizontal projection, and that is where a chin implant works best. Now, what is a chin implant? What is it made of? You get various types of chin implants. The one used most commonly is a silicone implant. We use silicone implants because they are very inert and they do not cause much problems or complications. The size of the implant is decided based on talking to the patient. As I said, we look at the projection, how much forward projection is needed, and we look at the horizontal length, again depending on the patient to patient. Typically for women, we prefer a little bit of a narrower implant. We don't want a very wide jawline. Men, we prefer implants which have wings that go into the jawline, and that way it gives a more stronger, more masculine chin. So this is how, in consultation with the patient, we decide what implant is to be used and how. Now, the final decision to be taken after you deciding an implant is how we are going to put it. The chin implant can be put either from inside the mouth or from under the chin. Both of them have their advantages and disadvantages. Putting it from inside the mouth, the biggest advantage obviously is you don't have any cut or mark on the outside of the body. The disadvantage is we're going from inside the mouth, so we're releasing all this muscle and tissue, so there is more swelling typically after this procedure. There's also a slightly higher chance of an infection happening, but that is not significant. The bigger issue is that there's going to be more swelling and bruising. For the putting the cut below the chin, big advantage is that there's not going to be much swelling. It heals very, very quickly, and theoretically there's a lower chance of an infection. The disadvantage is you have a small cut over here that is very hard for anyone to make out, but if someone comes right here and searches, then the tiny line they'll be able to see. So as I said, there are pros and cons to both. We leave it for the patient to decide what chooses them, what they are more interested in. Someone who absolutely doesn't want a scar, we go from inside the mouth. Someone who wants to recover quickly, they don't want people to know that they've done this procedure, we go from outside the mouth. So how does the surgery happen? The surgery typically happens as a daycare procedure. It's done under sedation or under mild general anesthesia. So the cut is made, a pocket is created, the implant is placed, and the implant is held in place with a metallic screw. We put 2 screws to hold the implant in place so that it doesn't move around. It is for this reason that we're screwing it in that we prefer to use sedation or general anesthesia. It can be done under local anesthesia, but then the screw fixation cannot happen, and we prefer the screw fixation to make sure that the implant is nice and solid and is not going to give you any problems long term. After the surgery, you go back home the same day. You feel pretty okay within 2-3 days. You can work on a laptop within 2-3 days. Your face will be noticeably swollen if the external incision for around 5 days, if the internal incision for maybe up to 7 to 10 days. Typically after this time, you can go out and no one will be able to know that you have done something. We ask the patient to avoid very heavy talking or chewing for a few days to avoid swelling from building up. The swelling, initially, the result looks a little exaggerated. Particularly in women, it can look a little masculine, it can look a little wide, it can look a little swollen. As the swelling comes down, it starts looking more and more natural. In general, you see most of the result within 1 month. 100% of the result for everything to fully shrink and settle down takes around 2 to 3 months. Now, is this surgery safe? Yes, this is a very safe surgery, but any surgery anywhere in the body, there are complications which can happen. The worst complication is an infection happening. If an infection happens, we have to remove the implant, as simple as that. But the chance of this happening is extremely low, but it is not zero. And we do a lot of precautions to prevent this from happening. Other than that, some swelling can happen, as I told you. There can be occasionally some bruising. Most people don't bruise. If it bruises, it will go away, but it will take a couple of weeks to go away. Especially if you're going from inside of the mouth, the whole area can feel different. It can feel kind of stretched out, like your lips are not moving how they used to. That your body adjusts to it, but it can take a few weeks for you to feel fully accustomed and normal to it. Now, what about the other options other than chin implants? What are other options are there? The non-surgical options are fillers and fat grafting. Fillers are good for a temporary result. They last for around a year. It doesn't make sense to do fillers every year for the rest of your life. You can do fillers once as a kind of a test drive if you really want to do this surgery, and then go for a more permanent option. Fat grafting is good for mild augmentations. You want to improve the chin a little bit, it is good. It is not good for major augmentations because you're putting a huge bulge of fat over there and that feels unnatural, it feels abnormal. Genioplasty is the last option wherein a cut is made in the bone and the bone itself is moved around instead of putting an implant. This is a bigger surgery obviously. You're cutting the bone and moving it around and fixing it with plates. There is more swelling and more recovery. Typically, we recommend a genioplasty when vertical increase is needed, when the chin is very, very short. If it is just horizontal projection, an implant is much simpler and much smaller procedure. So I hope this video answered your questions about a chin implant. If you have any doubts or questions, do write to us. Do like, share and subscribe. Thank you. Have a great day.